is it clear? Nephropathy and all that are going to present with rapidly progressive glomerulonephritis syndrome, or they are going to present with the nephritic syndrome. Is it clear? And if you want to all understand this, you go on to with acute renal failure and chronic renal failure. Is it clear? So that is the type 3 hypersensitivity. And the last type of hypersensitivity, type 4 hypersensitivity reaction, peculiarly occurring when you are going to have is going to result to a chronic granuloma. Is it clear? So you are going to have chronic granuloma, particularly in type 4 hypersensitivity, because in this case, these are infections that are going to be chronic, that cannot be easily treated by the normal unspecific microorganisms on the unspecific cells of the body, immune cells of the bodies, like the neutrophils. So in this case, when you have bacteria, particularly like mycoplasma, when you have the case of Mycobacterium tuberculosis, like in a TB, or you have in a case of infectious mononucleosis, like in the case of Epstein-Barr virus infection, infectious mononucleosis, you see that at the initial start, when you have an infection, the neutrophils are the first one that are going to try to control the infection and those other unspecific cells. Is it clear? The neutrophils are the one that goes with those other unspecific cells to treat the infection. But in the case of a chronic granuloma, in the case of a type 4 hypersensitivity, this microorganism like Mycobacterium tuberculosis and Epstein-Barr virus is resulting to infectious mononucleosis are very resistant to those unspecific microorganisms. So they are going to result to the death of those unspecific microorganisms, and thus you're going to have now specific microorganisms, specific cells. So they are going to result to the death of the unspecific immune cells. So the specific cells now are the one that are going to target those microorganisms. Is it clear? And those specific cells are going to be made up of the giant cells. You're going to have the giant cells, and the giant cells are cells which they are also called the histiocytes. Is it clear? The giant cells or the histiocytes. Is it clear? Histiocytes are just macrophages which are specialized in tissues. Is it clear? You're going to have macrophages which are specialized in tissue. They are histiocytes. Is it clear? Or we have also epithelioid tissues, epithelioid cells. Is it clear? So all these are macrophages. Is it clear? The histiocytes are peculiar macrophages which are specialized in tissues. The epithelioid cells are just specialized macrophages, and the giant cells are specialized macrophages which have fused together to produce a very big cell or a giant cell. Is it clear? So all these are specialized macrophages. So specialized macrophages now are the one that are going to try to control the chronic infection. Is it clear? And in addition to those specialized macrophages, you're also going to have T helper cells. Is it clear? Which is going to help in the control of those chronic infections. Is it clear? And now when they're going to try to control those chronic infections, they're going to produce what is called the chronic granulomas. Is it clear? And chronic granulomas can either occur in a case, it can either be divided into two. It can be caseating or it can be non-caseating. Is it clear? In the case of caseating, you are going to have necrotic tissue at the center of the granuloma, meaning that the cells of the center of the granuloma are nucleated. They don't have any nucleus. When you don't have any nucleus, it means that you are a dead cell. Is it clear? So you have necrotic tissues in the case of the caseating granulomas. So now, in non-caseating granulomas, the tissues are non-necrotic. Is it clear? They are non-necrotic, meaning that at the center of the granuloma, the cells are still having their nuclei, meaning that they are not dead. Is it clear? So that is the division and that you are going to have. So this is how I want you to understand how infection, the mechanism of infection can occur. When you want to understand generally the mechanism of infection, you have to know that there is a mechanism based on the microorganism, and that mechanism can be from the primary focus to the systemic spread, and it is only the microorganism that does that. And now the second mechanism is based on the immune response, and the immune response can be divided into two. It can be divided into over immune response, or it can be divided into under immune response. When you have under immune response, it means that the only mechanism that is under immune response is going to be the mechanism of the microorganism colonization, meaning that it is still the primary focus of the systemic spread. In the case of under immune response, it is the microorganism that is actually the problem in the infection. Is it clear? But in the case of autoimmune response, it is the body that is actually, or the immune system that is actually the problem of the infection. Is it clear? And now you can also have normal immune response. And in the case of normal immune response, we just have the last mechanism is the case of normal immune response. Is it clear? And in the case of normal immune response, there you just have the normal mechanism of immune response, which is we are going to have the activation of the cyclooxygenase pathway. You're going to have as activation the lipooxygenase pathway. For the cyclooxygenase pathway, you're going to have prostaglandin secretion. The lipooxygenase pathway, you're going to have the interleukin secretions. Is it clear? The interleukin secretions. And then the last one, you're going to have the cells, the cellular pathway. For the cellular pathway, is divided into unspecific and then the specific. And for the unspecific cells, we have the neutrophils that are going to target bacteria, actually acute bacterial infections. We have the eosinophils that is going to target the acute parasitic infections. And then we have the MAC monocytes and also the natural killer cells, unspecific monocytes and natural killer cells that are going to target viruses. Is it clear? And then for the specific, we have the specialized monocytes, like the case of epithelioid cells, and we have the cellular and the humoral immune response. For the cellular immune response, we have the T cells, which is divided into the T helper cell and the cytotoxic T cells, and then we have the B cells, which is divided into we have the B cells, which is also involved in the specific pathway. So from here we are finished now with all the mechanisms which is under an infection. Is it clear? Don't forget all these mechanisms when you are dealing with a patient that has an infection in front of you. Thank you.